So even in the best of circumstances, unfortunately, dural tears do happen. This can happen whether you're doing an open procedure or a decompression through a tube. Doing the procedure through a tube has a set of unique challenges that can make repairing the dura somewhat more difficult. Number one, the access to the tear, depending on where it is in the decompression. So if it's on the contralateral side, it's very difficult to get access to the dura for a direct repair. And even if it is on the ipsilateral side of your decompression, the challenges of sewing through a tube is significant. So there's a few ways to deal with this. First of all, there are special instruments available. Now, to do tubular surgery, we all have our set of bayoneted instruments, of short instruments perhaps for your microscope, and a whole slew of things on your back table in order to make your tubular decompression possible, smooth, and easy. There is also a set of micro instruments that you can get for your hospital that I keep on the back shelf. I don't open it for every case, but there is a set of micro instruments with a bayoneted needle driver as well as some forceps which allow you to repair the dura. Another tip is have a endoscopic knot pusher around to allow you to sew the dura and then push your knots down to get a tight repair. Now, there are situations, unfortunately, where the direct repair is not possible and is not feasible, but usually you can still get away with a good outcome for your patients. What I've been using is mostly a patch, so either that's something like a Duragen or even a piece of gel foam can work if you let the blood soak up onto it and form a clot over the repair. And I think fundamentally the environment where you're doing the surgery through a tube versus open is different and allows you to get away with a less robust repair because there is not really a big dead space present. When you do an open decompression, you've taken away a lot of bone, you've taken away a lot of muscle perhaps during your exposure, and therefore you have this open space where your repair can become compromised or fail. When you're doing surgery through a tube, when you take that tube out, all the muscle collapses right back down onto your surgical bed, and in effect it's reinforcing your repair. So when I do get a tear during a tubular surgery, if I can repair it directly, I do. If there are situations where direct repair is not possible, I put a patch on and use the nature of the surgery to reinforce the repair, and patients have done well in that respect. Thank you.